Psychology, Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Psychology, Things You Should Know, Questions and Answers. This book will give you a good general knowledge about the essentials of psychology and more. Part 1. 1. What is psychology? Psychology is the study of human behavior. 2. What are some scientific methods? Observation, questions, hypothesis, theory, experiments, replication, and surveys. 3. What is hypothesis? Hypothesis is a scientific guess. 4. What is a theory? A theory is a supposition intended to explain something. 5. What is the observation method? The observation method is simply watching a subject without any intervention. 6. What is the advantage of the observation method? The observation method permits to properly describe behavior. 7. What is the limitation of the observation method? Although the subject is well described, one cannot really explain what they observe. 8. What is clinical psychology? Clinical psychology is the psychology that focuses on mental behaviors and illnesses. 9. What is cross-cultural psychology? Cross-cultural psychology is the psychology that studies cultural similarities and differences. 10. What is the humanistic theories? The humanistic theories are theories that focalize on human self-growth and improvement. Part 2. 1. What is positive reinforcement? Positive reinforcement is when a reward is given, when the desired outcome is achieved, in order to encourage and strengthen the stimulus that produces the desired results, by adding a pleasant stimulus. 2. What is negative reinforcement? Negative reinforcement is when a reward is given, when the desired outcome is achieved, in order to encourage and strengthen the stimulus that produces the desired results, by removing an aversive stimulus. 3. Give an example of a positive reinforcement. When a father buys a video game for his son because he did well in his exams. 4. Give an example of a negative reinforcement. When a mother nags her children because they refuse to do their homework. 5. What is the main difference between a punishment and a negative reinforcement? A punishment is meant to decrease a behavior, whereas a negative reinforcement is meant to increase a behavior. 6. What is continuous reinforcement? Continuous reinforcement is a kind of reinforcement that compels a person to repeat a behavior. 7. Give an example of a continuous reinforcement. Giving a child a treat each time he/she has a good mark in school. 8. Can continuous reinforcement be negative? Yes, continuous reinforcement can be negative. 9. What is cataplexy? Cataplexy is a sudden loss of control of the muscle strength. 10. What is an important cause of cataplexy? An intense emotion. Part 3. 1. What is psychoanalysis? Psychoanalysis is the study and understanding of the human mind using therapeutic techniques. 2. What is correlation? Correlation is when there is a link, a relationship between two things. 3. What is causation? Causation is the factor that makes something to happen. 4. Is correlation equal to causation? No, correlation is not equal to causation. 5. What is the relationship between correlation and causation? The relationship between correlation and causation is that it shows the possibility of a cause and effect. 6. What is the principle of proximity? The principle of proximity is when things that seem close to each other are placed together. 7. What is the similarity principle? The similarity principle is when things that look the same are put together. 8. What is withdrawal? Withdrawal is the difficulty and discomfort observed when the use of a drug is stopped. 9. What is the law of effect? The law of effect is a response that produces a satisfying result in a certain situation, is more likely to occur again in that situation. 10. What is a cognitive map? A cognitive map is a mental representation of one's environment. Part 4. 1. What is psychotherapy? Psychotherapy is a form of treatment of psychological disorders. 2. What is schizophrenia? Schizophrenia is a mental disorder that involves delusions and hallucinations. 3. What are some symptoms of schizophrenia? Symptoms of schizophrenia are delusions, hallucination, avolition, lack of motivation, difficulty to concentrate, communication difficulties, etc. 4. What could be some causes of schizophrenia? The causes of schizophrenia could be genetic, stress, the abuse of certain drugs, or a chemical imbalance in the brain. 5. What is dementia? Dementia is the degeneration of neurons in the brain. 6. What is Alzheimer's disease? Alzheimer's disease is the loss of memory due to the degeneration of neurons in the brain. 7. What is long-term memory? Long-term memory is the memory that holds information for a very long time. It could remain a lifetime. 8. What is procedural memory? Procedural memory is a type of long-term memory responsible for our motor skills. 9. What is somatic memory? Somatic memory is a type of long-term memory that comprises of the general knowledge accumulated in our life. 10. What is episodic memory? Episodic memory is a type of memory that comprises of specific events in the past. They are personal experiences. 11. What is declarative memory? Declarative memory is a type of memory that is also called explicit memory, and it can be recalled at all times. Part 5. 1. What is selective forgetting? Selective forgetting is the forgetting of only traumatic events. 2. What is exposure therapy? Exposure therapy is gradually exposing a person to what he/she is afraid of in order to reduce the fear. 3. What is functionalism? Functionalism is the study of the functions of the mind. 4. What is phrenology? Phrenology is a pseudoscience that links the shape and size of the cranium to mental faculties. 5. What are the psychosexual stages? The psychosexual stages are the oral, anal, phallic, latency, and genital stages. 6. What is referential thinking? Referential thinking is giving personal meaning to random events. 7. What is a false consensus effect? A false consensus effect is when we overestimate that other people share our beliefs and thoughts. 8. What is social psychology? Social psychology is the way in which people relate to one another. 9. What is a reaction formation? A reaction formation is a defense mechanism in which a person acts in a way that is opposite to his/her disturbing emotions. 10. Define rationalization. Rationalization is the self-justification of a situation instead of addressing its real reason. Part 6. 1. What is biomedical therapy? Biomedical therapy is the treatment of psychological disorders by the use of drugs, therapies, psychosurgery, etc. 2. What is behavioral therapy? Behavioral therapy is a therapy aimed at reinforcing the behaviors we want and eliminating the behaviors that we don't want. 3. What is pharmacotherapy? Pharmacotherapy is the therapy with the use of drugs. 4. What is behaviorist perspective? Behaviorist perspective is the perspective of how much we are influenced by the environment. 5. What is cognitive psychology? Cognitive psychology is the branch of psychology that tries to understand people's behavior by the way they think. 6. What is vicarious conditioning? Vicarious conditioning is learning through the reaction of others to a stimulus. 7. What is proactive interference? Proactive interference is when old information interferes with new information. 8. What is retroactive interference? Retroactive interference is when new information interferes with old information. 9. What is sublimation? Sublimation is a defense mechanism that transforms unwanted actions, behaviors into acceptable actions, behaviors. 10. What is a flat affect? A flat affect is the act of showing very little to no emotions. Part 7. 1. What is the hindsight bias? The hindsight bias is the tendency of people to overestimate their ability to predict the outcome of an event. 2. What is kinesthesis? Kinesthesis is how your body senses changes in the position of the body. 3. What is classical conditioning? Classical conditioning is a learning procedure that consists of linking two or more stimuli in order to produce a behavioral response. 4. What is operant conditioning? Operant conditioning is learning that uses rewards or punishment to trigger behavior. 5. What is repression? Repression is the process of suppressing thoughts, memories that make us uncomfortable. 6. What is regression? Regression is a defense mechanism when a person falls back to his old traits. 7. What is projection? Projection is when we disguise our impulses by attributing them to other people or another person. 8. Give an example of repression. A child who had an abusive childhood and suppresses the past. 9. Give an example of regression. A person starts sucking his thumb like he used to when he was a child. 10. Give an example of projection. You tell somebody that he/she is not capable of achieving something, but the truth is that you are projecting your fears to another person. 11. Give an example of rationalization. I know that I am supposed to go to the gym, but I met a friend on my way, and I spent a lot of time talking to him, and I lost track of time. 12. Give an example of displacement. When you had a bad day at work and return home and yell at your children. Part 8. 1. What are hormones? Hormones are chemical messengers. 2. Give examples of some important hormones. Testosterone, estrogens, insulin, thyroxine, growth hormone, etc. 3. What are the functions of the frontal lobes of the brain? Speaking, abstract thinking, making decisions, etc. 4. What are the functions of the parietal lobes of the brain? The perception of touch, etc. 5. What is the function of the right hemisphere of the brain? Logic, language, etc. 6. What is the function of the left hemisphere of the brain? Creativity. 7. What is the function of the limbic system? The limbic system is the emotional part of the brain. 8. What is the function of the hippocampus? The hippocampus plays a key factor in long-term memory. 9. What is the function of the central nervous system? The main functions of the central nervous system are integration and coordination. 10. What is the function of the peripheral nervous system? The peripheral nervous system connects the central nervous system to the organs. Part 9. 1. What is serotonin? Serotonin is a neurotransmitter that influences our appetite, mood, and sleep. 2. What is dopamine? Dopamine is a neurotransmitter that aids in memory, movement, emotion, and pleasure. 3. What is the function of the cerebellum? The coordination of movement and maintaining balance. 4. What is the function of the pons? The pons is a kind of bridge that transmits messages between the cortex and the cerebellum. 5. What is the function of the gray matter of the brain? The gray matter of the brain transports sensory information. 6. What is the function of the hypothalamus? The hypothalamus helps the body to maintain homeostasis. 7. What is the function of the temporal lobes? The temporal lobes process sound. 8. What is the function of the amygdala of the brain? The amygdala of the brain is involved in emotions and especially fear. 9. What is the function of the thalamus? The thalamus relays information to the cortex, it aids communication, and it regulates sleep and alertness. 10. What is acetylcholine? Acetylcholine is a neurotransmitter that aids learning, memory, and muscle movement. 11. What is the function of the medulla of the brain? The medulla of the brain aids in breathing, swallowing, heart rate reflexes, etc. Part 10. 1. What is dysthymic disorder? Dysthymic disorder is a mood disorder where there is a small amount of depression. 2. What is a bipolar disorder? A bipolar disorder is a mood disorder that consists of low and high moods. 3. What is paranoid schizophrenia? Paranoid schizophrenia is schizophrenia that consists of the fear of persecution. 4. What is catatonic schizophrenia? Catatonic schizophrenia is schizophrenia that consists of disturbances of movement. 5. What is undifferentiated schizophrenia? Undifferentiated schizophrenia is schizophrenia without a specific distinguishing symptom. 6. What is borderline personality disorder? Borderline personality disorder is a self-destructive behavior disorder that causes the individual to have unstable relationship, emotions, etc. 7. What is an autistic disorder? An autistic disorder is a childhood disorder whereby the child hardly develops normal patterns of social interaction, communication, etc. 8. What is cognitive dissonance? Cognitive dissonance is the problem associated with a person that does something that contradicts his/her values. 9. What is aphasia? Aphasia is a language disorder due to an injury or damage to certain parts of the brain. 10. What is narcolepsy? Narcolepsy is a neurologic chronic sleep disorder that can cause a person to suddenly fall asleep without warning. Part 11. 1. What is anorexia nervosa? Anorexia nervosa is an eating disorder in which a person refuses to eat the appropriate amount the body needs, and sometimes starves himself/herself to remain slim thin. This is a severe case of underweight. 2. Name some outcomes of anorexia nervosa. Fatigue, hair loss, dehydration, reduction in bone density, excessive loss in weight, and even death. 3. What is bulimia nervosa? Bulimia nervosa is when a person eats and then induces vomiting or use laxative in order to maintain a certain body weight or size. Excessive sport is also a possibility. 4. What are the risks of bulimia nervosa? The risks of bulimia nervosa is an irregular heartbeat, ulcers, deregulation of the digestive system, and inflammations. 5. What is body dysmorphic disorder? Body dysmorphic disorder is an obsession of a person with the physical imperfection or perceived imperfection of his/her body. 6. What is intrinsic motivation? Intrinsic motivation is the motivation that comes from within. It is an internal motivation that does not depend on external rewards. 7. What is extrinsic motivation? Extrinsic motivation is the motivation that is stimulated by external rewards. 8. Name 6 fundamental emotions. Happiness, sadness, surprise, anger, disgust, and fear. 9. What is echolalia? Echolalia is an autistic symptom in which a person repeats or echoes what he/she just heard. 10. What is a false positive? A false positive is a conclusion that indicates the presence of a given condition, when in fact there is no presence to that condition. Part 12. 1. What are case studies? Case studies are researches that focus on a study of one individual. 2. What is the limitation of case studies? Case studies sometimes can't be replicated. 3. What is a survey? A survey is a detailed study of something by collecting data and other important information. 4. What is an experimental group? An experimental group is the group that receives the clinical treatment. This group is also called the clinical trial. 5. What is a control group? A control group is the group that does not receive the clinical treatment. 6. What is homunculus? Homunculus is a mini version of a human. 7. What is language? Language is the ability to communicate in various forms, like speaking, signs, etc. 8. What is inferiority complex? Inferiority complex is the lack of self-esteem. 9. What is denial? Denial is when a person refuses to accept reality. 10. What is emotional intelligence? Emotional intelligence is when a person can identify and use effectively their emotions to achieve what they want. Part 13. 1. What are neurons? Neurons are electrically charged cells that receive and transfer information. 2. What is the function of the pituitary gland? The pituitary glands controls hormones like the adrenals, the thyroid gland, the testicles, and the ovaries. 3. What is a free association? A free association is when someone says his thoughts. 4. What is compulsion? Compulsion is an uncontrollable impulse to do certain things. 5. What is self-disclosure? Self-disclosure is the tendency to overshare information with people we hardly know. 6. Define sensation. Sensation is the process of how the brain receives information from outer stimuli. 7. Define perception. Perception is the process of how the brain interprets the information it receives. 8. What is motivation? Motivation is the desire to do something. 9. What is self-actualization? Self-actualization is our ability to live up to our highest best potential. 10. What is a double-blind experiment? A double-blind experiment is when the participants and the people conducting the research do not know which test group they belong to. Part 14. 1. What is a phobia? Phobia is an exaggerated fear of something. 2. What is the consequence of phobias? Phobias make us to avoid their triggers. 3. What is hypnosis? Hypnosis is a state in which a person is in a trance state and has no voluntary power of action. 4. Do all instincts require learning? No, all instincts do not require learning. 5. What is social loafing? Social loafing is when people in a group exert less effort to attain a common goal than when they have their individual goal. 6. What is the fundamental attribution error? The fundamental attribution error is when we judge people by the first impression we got from them. 7. What is the Pygmalion effect? The Pygmalion effect is the ability to achieve greatness if one is willing. 8. What is social phobia? Social phobia is a fear of avoidance of any social situation. 9. What is agoraphobia? Agoraphobia is the fear of being in public places. 10. What is hypochondriasis? Hypochondriasis is the fear of always being sick. Part 15. 1. What are endorphins? Endorphins are natural painkillers, and they also procure pleasure. 2. What are some of the triggers of endorphins? Eating what we like, exercising, having sex, laughing, listening to music we love, etc. 3. What is self-transcendence? Self-transcendence is our ability to find a purpose greater than ourselves. 4. Give some advantages of sleep. Recuperation, liberation of growth hormones, etc. 5. What is insomnia? Insomnia is a recurring difficulty sleeping, falling asleep or staying asleep. 6. What is sleep apnea? Sleep apnea is a temporary stop in breathing during sleep. 7. What is the function of the synapse? Synapse is where the point neurons meet. 8. What are alpha waves? Alpha waves are little slow brainwaves in the awake state. 9. What are delta waves? Delta waves are large, slow brainwaves in the deep sleep state. 10. What are beta waves? Beta waves are waves that indicate high and low frequency amplitude. Part 16. 1. What is consciousness? Consciousness is the sense of the awareness of ourselves and our surrounding. 2. Which part of the brain is responsible for speech? The Broca's area. 3. What is dualism? Dualism is the division into body and spirit. 4. What are amphetamines? Amphetamines are drugs that stimulate the body's neural activities. 5. What is the conscious? The conscious are thoughts, memories that a person is always aware. 6. What is the preconscious? The preconscious are the thoughts, memories that a person is not consciously aware at the moment, but can be easily accessed when needed. 7. What is the kind of dissociative disorder in which a person develops amnesia and thinks he/she has a new identity? Dissociative fugue. 8. What is a non-directive therapy? A non-directive therapy is a therapy in which the therapist permits and encourages the client-patient to take the lead. 9. What is OCD, obsessive-compulsive disorder? OCD is a mental disorder when a person is in a continuous cycle of obsession and compulsion over his/her ideas, feelings, etc. 10. What is the self-serving bias? The self-serving bias is when we attribute positive results to internal causes. Part 17. 1. What is neuroplasticity? Neuroplasticity is when the brain modifies itself after damage. 2. What is humanistic psychology? Humanistic psychology is the psychology that studies a person as a whole and what is unique about a person. 3. What is REM sleep? REM sleep is the dream stage of sleep and when there are rapid eye movements. 4. What is somnambulism? Somnambulism is sleepwalking. 5. What is latent learning? Latent learning is the kind of learning that is not immediately expressed until there is an incentive to show it. 6. What is retrograde amnesia? Retrograde amnesia is the loss of memory from the past. 7. What is anterograde amnesia? Anterograde amnesia is when one cannot form new memories that are long-term. 8. What is psychosis? Psychosis is the loss of contact with reality. 9. What are implicit norms? Implicit norms are rules of the society that are neither written nor spoken. 10. What are explicit norms? Explicit norms are written or spoken rules in the society. Part 18. 1. What is placebo effect? Placebo effect is a fake treatment. 2. What are depressants? Depressants are drugs that slow down the function of the central nervous system. 3. Give an example of a common depressant. An example of a common depressant is alcohol. 4. What are stimulants? Stimulants are substances that stimulate the body's activities. 5. Give some examples of stimulants. Nicotine, caffeine, energy drinks, etc. 6. What are hallucinogens? Hallucinogens are drugs that cause hallucinations. 7. Give examples of hallucinogens. LSD, lysergic acid diethylamide acid, DXM, dextromethorphan. 8. What are psychoactive drugs? Psychoactive drugs are drugs that alter the psychological state. They can affect our mood, behavior, etc. 9. What are narcotics? Narcotics are drugs that help us relax and relieve pain. 10. What is mutation? Mutation is the modification of a gene fragment. Part 19. 1. What is authoritative parenting? Authoritative parenting is when a parent makes rules for their children, explain the meaning and why they set these rules and are open to discuss them with their children. 2. What is authoritarian parenting? Authoritarian parenting is when parents impose rules for their children and expect them to obey without any discussion. 3. What is permissive parenting? Permissive parenting is the kind of parenting when the children make their own decisions, the parents permit the children to do so. 4. What is a primary reinforcer? A primary reinforcer is a reinforcer that is biological and rewards specific behaviors, example, food. 5. What is a secondary reinforcer? A secondary reinforcer is a reinforcer that is not biological and rewards specific behaviors, example, money. 6. What is prosocial behavior? Prosocial behavior is a positive and helpful behavior. 7. What is antisocial personality disorder? Antisocial personality disorder is when a person shows no conscience for doing wrong to people, even to family. 8. What is altruism? Altruism is the sincere concern and well-being of others. 9. What is the reward theory of attraction? The reward theory shows that people favor and like people that compliment them. 10. What are hygiene factors? Hygiene factors are factors essential for motivation at a workplace. They are factors that avoid dissatisfaction. Part 20. 1. What is egocentrism? Egocentrism is when one puts himself/herself as the center of attention. 2. What is empiricism? Empiricism is finding the truth by means of observations and experiences. 3. What is the psychoanalytic theory? Psychoanalytic theory is the distinction between consciousness and unconsciousness. 4. What is inattentional blindness? Inattentional blindness is when we don't see what is in front of us because our attention is elsewhere. 5. What is operant? Operant is a voluntary behavior. 6. What is suggestive questioning? Suggestive questioning is the kind of questioning that implies a certain answer. This kind of questioning makes a person to answer in a certain way expected by the person doing the questioning. 7. Who is a sociopath? Sociopath is a mental disorder of a person who has very little conscience and is extremely antisocial. 8. What is an antisocial personality? An antisocial personality is someone who has no sympathy for others. Conclusion. Thank you once again for listening to this book. I hope it has helped you gain more knowledge about the basic psychology terms and how we use them in our lives.